Welcome to your home medical provider. In this video, we'll be discussing the COVID-19 virus. In this video, we'll be going over symptoms of COVID, treatments, testing options, and updated CDC isolation recommendations. Symptoms of COVID include any combination of cough, shortness of breath, fever, headache, sore throat, loss of taste and smell, and other symptoms. Treatment for COVID includes increasing rest and hydration, symptomatic treatment most effectively with ibuprofen or acetaminophen, and the use of antiviral treatments specific to the COVID virus. The most common antiviral for COVID is Paxlovid, which is a combination of the medication Tamiflu and ritonavir. Paxlovid needs to be started within 72 hours of symptom onset to be effective and has side effects such as altered taste, diarrhea, and headache. There's also what's called rebound COVID with this medication, in which people start feeling better for a few days after taking it, and then symptoms return. Testing for COVID that can be done at home is the rapid antigen test. This test is going to be more convenient, cheaper, and have quicker results than the PCR test, but has a higher false negative rate. This test is more accurate 5 to 7 days post-symptom onset, which is well outside of the treatment window for Paxlovid. The reverse transcription polymerase chain reaction test, more commonly known as the PCR, tests for COVID RNA within the blood. This test has less false negatives than the rapid antigen test, but need to be seen by a provider to get this test, and the turnaround time for results takes longer, as it takes up to 48 hours to get the results back, which may put you outside the window of treatment with Paxlovid. Booking a telemedicine appointment would be appropriate for patients who have tested positive for COVID at home with mild symptoms, without shortness of breath or coughing up blood, and a fever below 102 Fahrenheit. Booking telemedicine appointment would be the quickest way to get a Paxlovid prescription, and this can help reduce the risk of spreading COVID. In-clinic appointment would be more appropriate for people with a known exposure with COVID who have not tested positive at home, or people with moderate or severe symptoms, including shortness of breath, decreased oxygen saturation, higher fever over 102 Fahrenheit. Depending on findings of the physical examination, your provider may send you to the emergency department for further evaluation and treatment. The Center for Disease Control recommends 5 days of isolation from symptom onset for people with mild symptoms, as long as the symptoms have improved by day 5 and they are fever-free without the use of fever-reducing medications. The CDC recommends 10 days of isolation post-onset of symptoms for a patient with moderate symptoms, meaning symptoms that could be treated at home, and fever-free for 24 hours without fever-reducing medications. The CDC recommends an isolation period of up to 20 days for people who have compromised immune systems, such as having cancer, HIV, or on medications that can depress the immune system, or patients that had really severe symptoms that needed a hospital stay for treatment. To reduce the risk of catching the COVID virus, include increasing hand washing, avoid touching the face, masking up when in crowded public areas, and keeping up to date on COVID vaccinations. I hope you or your loved one is feeling better soon. If you found this video helpful, please like and subscribe for other medical videos. Thank you.